Hello, my IMers. Thank you so much for joining. I'm Lisette, if it's the first time you're joining, and I'm joined by Dr. Samantha Patterson. How are you today?
I'm good. Thank you for having me.
No, thank you for having me. You're a doctor, you're busy, we know times are difficult. It's COVID, it's other sicknesses in between. But we're not talking about that today, although we probably should have, but that's that aside.
For another day.
For another day. Who is Dr. Patterson?
So I am a GP, and what that means is that I'm a generalist. I see patients across the board, whether it's young adults, pediatrics, geriatrics.
So the what atrics?
Geriatrics, so very old people.
Oh, okay.
You know, and I kind of like, I know a little bit about everything. And I'm kind of the channel between primary care and seeing a specialist.
Oh, okay. So then you just refer people as to when they
What
need
they
to.
need, yeah.
Okay. We're not actually going to be talking about why you're a doctor or things like that, but you came out into the scene at a very different time or whatever, but you became a sensation on Twitter for talking about a particular tweet or a particular facet in sex, and that was lube. And that's why we got you on the show. We're actually going to be talking, they call it the sex doctor, or you call yourself the sex doctor on Twitter.
Yeah, or just Dr. Sam Sex Health. So
oh,
I mean,
my bad.
but you can call me that, yeah. So I have a special interest in sexual health.
How did
I get there?
Yeah.
Yeah, interesting story, because it's not necessarily something I would have, you know, gone to like directly. But in practicing general medicine, you sort of realize that it's, you know, everybody is having sex, and it's a human experience.
Yeah.
And so I was finding that a lot of people at the end of the consultation would ask me something about sexual health. And I'm practicing what we call holistic medicine. So it's trying to look at the patient through all the facets of their life. And sexual health is a major aspect of everybody. And then you'll also be surprised at how little the general public knows about these things, and how hungry people are for this conversation. So that's why I took it to social media, which is not a typical channel for medical professionals, but we're also trying to change the times, you know?
Yeah, 100% absolutely. I was about to say that it's very rare that doctors come and actually speak about their experience. I guess it's a doctor-patient thing that you might have, where you have confidentiality problems that you don't feel open to sharing information, or maybe, I don't know.
Yeah.
But now that you said that, we went on our Twitter streets, and I am as well, on Instagram, and we just asked our viewers to sort of come in with their questions, and I mean, it came in rolling. So I want to put that disclaimer, because a lot of these questions are, is there anything off bounds before?
No, there isn't.
Really?
And that's how I am with my consultations. It's, you know, people want to know, so I think you can go wherever you want to.
Okay, we're ready. So right off the bat, is being celibate healthy?
So describing something as healthy or not, you know, it's what is health. So
actually, let's take a step back. What is sexual health?
Yeah. So it differs for everybody. So it depends what your initial preconceptions about sexual activity or sexual engagement is, and so having sexual desire is a normal human feeling, and a normal human, it's a physiological process. So it means that you know, when people get to puberty and they start feeling these feelings, it's a natural process. It's not to say that if you go without it, or if you choose not to have it, that you're not healthy. It's one aspect of your life that you might not be exploring. So it's like deciding, do I like to exercise? We know exercise is healthy, but not everybody does it, and their lives are not any worse for it. And so I like to look at it more from what it can offer you, which is a lot of emotional well-being. It releases endorphins. It's a way of nurturing your romantic relationships, and it's a journey of like self-discovery. So I technically, because I am the sex doctor, I do promote it, because I think it's one component of a healthy life, or like a fulfilled life. But it's not to say that if you don't do it, it's unhealthy. It's another avenue that if you explore, you might find benefit.
Yeah. And now talking about you promoting it, how often should a person have sex, like generally?
So again, there's really no prescribed number of times. It varies even with the people that I see. So some people are having sex twice a day. Some people are having sex once a month, and it's not something that you can put a number on. And also things like age, comorbidities, or like other illnesses that you have might get in the way of that. Stress and anxiety gets in the way of that, and just like general life pressures. So as soon as you start putting a number on it, it stops becoming a natural, enjoyable thing. So I really can't give a number.
That's fair. That's fair.
Yeah.
And can everybody have an orgasm if they do, engage in sex?
Yeah. So almost everybody is capable of having one. There are certain conditions, like medical conditions, which make that almost impossible or very difficult to achieve. But even achieving orgasm, it's a multifactorial thing. So there's a psychological component, how aroused you are. Some people can't achieve orgasms in particular situations or with particular types of stimulation. So and then with some medical conditions, if you've had like pelvic surgery or something that interferes with your neural pathways, so you can't actually get there. But for the large majority of people, so I'd say even like 95% of people, even if you're not having an orgasm or you've never experienced one, for the most part we can work on it, and for the most part it's psychological. And as much as psychological things are difficult to treat, they are treatable. And it's really about getting to the bottom of why it's not there.
And then what happens in the opposite, the opposite side of the spectrum, where I think there was an article long ago, it was in the US that I read, where a lady would have an orgasm on the fly all the time, no stimulation, like just
she could smell something.
Yes, and then what is that?
So, and that's the thing, it doesn't necessarily have to, or you can have associations that are sexually arousing. So for those rare people where the smell of something or a memory can trigger an orgasm, or like hypnosis can trigger it. To be honest, you'll have to undergo like cognitive behavioral therapy, which is basically to try and reframe what's triggering you. Obviously, if it's inhibiting like your daily functioning, but if it's not, maybe they're just lucky people.
Enjoy. But is it possible to orgasm? Okay, I think you sort of answered that, but just I'm reading the questions as they come in. But is it possible to orgasm without vaginal, or how do you say this word? Penile stimulation. Penile, thank you. Stimulation.
Yeah, it's definitely possible. So vaginal, and differentiating that between clitoral and intravaginal, and that's definitely possible. And a lot of people can orgasm just with nipple stimulation or gentle touching in erogenous zones, which are essentially like the inside of the thigh. The ear tends to sometimes be a little bit sensitive, so it's definitely possible.
Is that also like sort of psychological, or not exactly?
Or but all orgasms are partly psychological. But that one, it's not necessarily psychological only. It is also through stimulating particular nerves. So yeah, but it's definitely
like your ears,
possible.
Nipples, and such.
Yeah.
Okay, and then can sex delay menopause?
So not quite. It's not necessarily proven that it can necessarily delay menopause. So while it's difficult for to draw, is this a cause for something, or is it just a correlation? And I think a lot of the myth or the theory around that is probably just that in people that have a later onset of menopause, they might also be associated with having more sex, and so we assume that that's a correlation. But it's not scientifically proven.
So it's like a myth.
Yeah, so I wouldn't take it as medically proven.
Yet, I'm joking. And then, is it possible for partners to not be sexually compatible? So dating is great, but just the sex ain't great.
Yeah. So no, I as like a first off answer, definitely not. Incompatibility is
really
it's a perceived thing. So
okay.
And again, it's because sex is multifactorial. So you might find that we have a really good like romantic relationship, but for some reason either we have very different views about what we should bring to the bedroom, like what my perception of sex is, and my partner's might be totally different, which means it's not enjoyable.
Yeah.
A lot of the time people ask about like physical incompatibility, which I think that's often what people allude to when they ask.
Yeah.
Generally that's also very rare.
Yeah.
And there's, with the correct foreplay and the correct stimulation, almost anybody can have full penetrative sex with their partner and have it be enjoyable.
Okay.
So it's really just about managing the relationship expectations and ways to work around what you think the incompatibility is.
Yeah. And just speaking on like the different perceptions, what sort of perceptions do people have? Like what? So it's penetration, and some people think of it as what?
You mean in terms of incompatibility?
Yeah. Or just in, like, when you were mentioning, just some people's perception of sex is very different in a relationship.
And it's that whole thing of that sex doesn't start in the bedroom, so it's how much some people might respond mainly to dirty talk or something that's a little bit more fantasy or conceptual, and that's their only way or one of the major ways that they become aroused.
Okay.
And if you don't have that, the other partner might just be like, well, I'm not getting anywhere with this.
Yeah.
Or they might need visual stimulation before they can get to the point where penetrative sex is an option.
Okay.
So it's more about and then it's also things like, did you woo me throughout the day and make me excited to want to have sex with you, and not just, well, we've had supper, it's 8 p.m, let's go. Yeah.
And then what do you think of sex toys?
Sex toys are brilliant. They are basically adjuncts to pleasurable sex, and we're just lucky that we live in an era where, and they've also been around for centuries.
Really? I thought it was like a 21st century thing.
No, they've got like 18th century like vibrators, and and they were essentially initially used as medical therapy.
Yeah.
So sex toys.
Wait, what?
Yeah, I know. Yeah, but that's a story for another day.
Okay.
But essentially, they, it just gives you the ability to be varied in how you stimulate each other. So whether it's the ability to literally stimulate in a more like fine touch manner with a vibrator versus using cock rings, one for like the visual appealingness of it, or for longer stamina. All of those things are just ways of enhancing sex.
Yeah.
And then beyond that, even for self-stimulation or masturbation, it's, it can get quite limited if you don't use toys.
Okay.
So it just opens a bigger door for what you're capable of doing, and start looking at it as a exploratory thing.
Yeah. And like, how far should the exploring go? Like, what sex toys should people stay out of, in the sense that I know, like with women and pH levels, like which one is a no-go for both girls and guys? Yeah.
So generally, sex toys that are like readily available, generally made of silicone. So they are, as long as you've cared for them properly, wash them in between, rather don't use them with multiple partners. It's quite an inert hygienic material. So as far as like what you can use, it's actually very wide. It's really just more about like, are you hygienic when you're using them?
Yeah. And speaking of hygiene, is oral sex hygienic?
Yeah. So interestingly, there's this saying that the vagina is cleaner than the mouth. and this is from from the perspective of the bacterial content.
Okay.
So assuming that something isn't clean when it's got a particular bacteria in it, if cared for properly, and generally we are self-cleaning. So the organisms and the bacteria in the vagina and on the penis, provided there's no other STD or infection, makes oral sex with a partner that you know their HIV status or their STD status is completely safe.
Really? Interesting. I thought it wasn't. My non-medical opinion. But now we had a viewer that asked, what does it mean if you get a sore tummy or cramp during sex? Described it as if though it feels like a stitch. Yeah. What is that?
Yeah. So that can actually happen quite commonly.
Okay.
So I'm presuming it's a female viewer. And so generally the uterus or the womb and your ovaries, they're what we call mobile structures. So they're not really tethered to anything. You just have your vagina, and then your womb is quite like free in your pelvis.
Yeah.
And so if a penis or whatever else is being used to penetrate you, like maybe pushes a little bit hard or a little bit deeply, you can pull on your ligaments. Okay. So that's essentially what that pain is from. Yeah. It's not dangerous.
It's just uncomfortable.
It's uncomfortable, and it can be like a lasting ache, for like 20 minutes or so. Yeah.
Wait. After.
Yeah. After. So. But generally, like if it goes away, it's really nothing to worry about. If something persists and if it's severe, that's when you would need to get it checked out. But otherwise, it's a fairly common occurrence. You might just have to be more gentle next time.
And then, could guys like have a similar thing?
Have a pain? So they don't really talk about abdominal pain, but often you can find that they have testicular pain. So during vigorous sexual activity, sometimes the one testicle can like retract up, and that might produce a little bit of abdominal discomfort. Or if you have what's called undescended testicles, so they're undescended testicles. So they're a little bit more in your abdomen than in your scrotum. And that can give you abdominal pain.
Jeez, the sex thing, man, it's a lot. It's a lot. And to what made you famous? Are all lubes safe?
So the thing is, everybody's making a lube now, and everybody's calling it, a natural, organic, and all of those things. And so, to be honest, it's like when you buy a facial cream, you can't necessarily be sure that it's been tested or that it won't react with you. So I think it would ideally rather stick to mainstream lubes, and do like a test patch. So rather try it on a sensitive area, maybe like on the inside of the thigh. Give it about an hour or two and just see that you don't react. So that's more from like an allergic perspective. So lubes that contain glycerin, that's usually what gets people reacting. So oil-based lubes can do that. And so if you have particularly sensitive skin or have allergies, then rather pick non-glycerin containing. And then regarding like your pH or like the bacterial balance in your vagina, the pH of the vagina is around about 3.8 to 4.5, so it's fairly acidic. And lubes are quite alkaline, so it's not, in general, if you haven't had much of a reaction, that's okay. Most lubes are fairly safe. And if you actually think about the amount that actually goes into the vagina is actually not a lot. It's usually just on the outside surface. And so, but it can predispose you to like a shift in your bacteria. So if you're finding that you might have like an unusual discharge after using a lube, or skin irritation, then you need to know to discontinue it. But you kind of can't know beforehand.
And what is an unusual discharge? Like all of a sudden it's green or...
So there is a normal, what we call physiological discharge that every woman has, and to varying degrees, and it's normal. So and it sometimes changes with your cycle. It gets a bit thinner or thicker depending on where you are in the cycle.
Yeah.
But that discharge is generally doesn't smell bad or doesn't smell at all.
Yeah.
And is not like a huge amount. So it's generally not staining your underwear too much or anything. A discharge that is concerning or that is unusual is one, it will smell different. And that's usually the most common thing that causes a change in discharge that isn't an STD is something called bacterial vaginosis. And that tends to smell quite fishy.
Yeah.
And the color changes, so it gets quite thin. It can go either gray or greeny yellow.
Okay.
So that's usually like the thing to look out for.
Yeah.
The other condition is like a vaginal thrush.
Okay.
Or like a yeast infection.
Yes. I was about to touch on that. Yeah.
Which is also associated with like use of soaps or bubble baths or a lube that has reacted badly with you.
Yeah.
And for both these instances, they disrupt the normal bacterial balance of your vagina. And so a yeast infection tends to be like a thick, cheesy white discharge, and you find that you're vaginally very itchy.
Yeah.
But those are usually the two that would be something unusual that isn't necessarily an STD.
Okay, got you. And now with the just the lubes and talking about that, how often should you use lube? Or like, I don't know if it was you yourself that was advocating for always using lube or not. What is the general
consensus on it?
Yeah.
So ideally, if you're finding that there is no excess friction, you feel quite happily lubricated naturally.
Yeah.
Then there's no real need to use it.
Okay.
But on average, there will be instances where either you don't have an excessive amount of time to like spend the time with all the foreplay, getting each other aroused and getting her wet, that it's kind of like a nice quick fix.
Yeah.
And so ideally, like, use it when you would like to. Generally with sex toys, I would recommend using it most of the time.
Okay.
And just because like the material it's harder and less forgiving than like skin on skin.
Yes.
So I would recommend have it next to the bed so that it's available for whenever you need it. And you can either go from using it all the time to just when you need the extra boost.
Okay. And just speaking of just like arousal and things like that, what medical thing is behind if somebody you're sort of foreplaying and then now it's time to do the deed and the person lose the erection? Both girl and guy. Can I say that? Yeah.
So generally in a situation like that where you've attained an erection or like attained arousal and then all of a sudden it goes away.
Yes.
Most of the time it tends to be psychological because all it means is that you are capable of having one.
Yeah.
But it's not lasting. So technically that is erectile dysfunction because you're not getting to the point where I'm having fulfilled and satisfying sex and we've completed like our whole deed or our whole playtime. And so for the most part, and like almost 80% of people or men particularly, it's a psychological thing. It might be like a performance anxiety thing. So he might be feeling under considerable pressure or and so that suddenly changes when he actually really needs the erect penis. Medically though, often in a lot older men, although we do see young men with erectile dysfunction, medically it can be a sign of other conditions. So particularly in overweight people over the age of 40 or so, it can be one of the first signs of like cardiovascular or heart issues.
Oh, is it?
So it's definitely something to be checked out, like, not to be ignored. One, because we'd like to enhance this aspect of your health, and nobody wants to go around feeling like they're not able to have sex. but it can be something like that.
Yeah, and also diabetics, if you like a certain type.
Especially diabetics. So it's all related to the same thing essentially, which is your blood vessels, because an erection is
a rush of blood.
It is. It's exactly that. So it's a rush of blood to the penis, and if there's anything constricting that flow of blood, so in diabetes, in high cholesterol, in high blood pressure, that's something that's like getting in the way.
Okay, got you. And like just with people that are HIV positive, at what point, or can they have normal sex while you are HIV positive? So your partner's not, but you are, vice versa.
Yeah. Definitely. In fact, like HIV shouldn't be a preclusion to a healthy and enjoyable sex life. So ideally, I think the only thing in question with that would be, your propensity to pass it on to your partner.
Okay.
So while there's this new thing we've sort of launched, which is that if you're undetectable, you're untransmittable. So in HIV, there's a thing called the viral load, which is tells you the degree of HIV within the blood. And if that is undetectable, which means that we can't find it when we test you, which is what happens with people that are taking treatment successfully and well controlled. So if they are on their treatment and their viral load is undetectable, they can actually have unprotected or condomless sex with their partner, without the risk of transmitting it to their partner. But we obviously don't necessarily recommend this because, or like not off the bat, because ideally the safety of your partner is paramount. So that's more for the case of if you're trying to conceive. That's when we would sort of say then, in this instance, this is when it's safe to do. But it's proving that you can have HIV, be well controlled on medication, and not pass it on to your partner, which means you're able to do every normal sexual activity.
And not have to worry about that. But now, what happens with the child? Can you still take HIV treatment while you're pregnant? It doesn't harm the baby.
So in fact, it's paramount that you do take it. Because that is the way in which we prevent the transmission of HIV to children. So it has to, it's like it's a has to be taken.
Okay, thank you for that. And is there any indication that a guy is aroused besides having an erect penis? They asked.
And I think this is something I feel sorry for men in a way, because like, there's a huge focus on the penis, and like everyone knows now about the clitoris, and like we know that we're so varied. But there are. So as much as an erect penis is the biggest sign,
the obvious one.
So physiologically things change as well. So pupils dilate, his heart rate also goes like faster, he might start heavy breathing, or like clenching his abdominal muscles. And those are all like reflex or involuntary things that show that he's aroused.
And then what do you do then to stimulate your partner if they're not exactly erect?
I see. So it I think often the longer you are with someone, the more you can determine what it is that works for them. And in terms of like particularly like penile stimulation, it also varies. So I mean, ideally, in the same way as with women, it has to be more than just a hand job or a blow job, and as much as that's definitely like a usual like quick fix, he also would need some like fantasy or some sort of like verbal encouragement. People like to be lifted up when they're in the bedroom, and in the same way that women like to be told that they're beautiful, men also do, and they have feelings about it. So that's definitely like one way to start. And then also just touching other parts of his body. A lot of other areas also around his nipple or around the side of his chest also are erogenous zones.
Okay. Men are people too, guys. We didn't know. But what causes some people to have low libidos?
Yeah, so again,
psychological
it's
as well.
Psychological, yeah. Because I would almost say that sex is 80% psychological. And particularly libido, where it's, this is the desire to have sex. And in the same way that you don't necessarily have the desire to do something else that you enjoy.
Yeah.
Mainly, a lot of the time, stress and anxiety is the biggest one. So if people are either overworked or they are not getting enough sleep, sex becomes like a bit lower down on the list of things, and it tends to become something that then requires effort. So that's one. But beyond that, it's also whatever's happening interpersonally with the relationship. So in order to desire sex, you want to feel desirable yourself, and if you're not getting that, it's quite difficult to decide that I'd like to share this with that person. So that's also a big contributing factor. And then there are like real medical reasons why not. So a lot of medications, some antidepressants can completely remove that desire. And so it's when you go and see your doctor, it's something that you want to be checked, that it's not something completely fixable. It's just the medication that you're on. I think even high blood pressure medications can also do that.
Is it? Okay, I got you. And should you have sex on your periods?
So
or period?
I think if you can, you is definitely you can. So it's really up to personal preference. It's what you're comfortable with. It's what your partner's comfortable with. A lot of women that do have sex on their periods find it particularly, they find the stimulation to somehow be different, almost more arousing and more in tune with a lot of the sensations that they're feeling. While on the other side of the spectrum, there's women that it's the last thing that they're thinking of. And same goes for the partner, you know. So it's definitely something that you can do, and it doesn't pose a health risk or an infection risk any more than non-period sex. But then of course there is also, it does pose an increased HIV risk, let's say, because remember now you have like another body fluid that can transmit.
Okay, got you.
Okay,
so it's not a bad thing if you have sex on your periods, as long as both are in consensus and you're happy to do it. What about anal sex? How do you make that more pleasurable? Like, is it safe? So
for heterosexual couples, it's actually something that people like want to know more about, but they tend there's this element of shame around it. And for homosexual couples, it's not to say that that's the only type of sex that they can have, but it's commonly performed. So is it safe? It's completely safe. The only thing that you would sort of need to look out for is that the vagina is more of it's like a thicker and tougher muscle, so you don't have to be as gentle as with anal sex. So anal sex is completely healthy. It's a completely normal thing to engage in, but you need to be quite careful because the potential for trauma is a lot higher. So the muscle or the sphincter is not as pliable as a vagina, and so the risk again of trauma is high. And it doesn't really self-lubricate the way a vagina does. So in terms of like how to make this better, or like how to enjoy it a lot more, is the type of lube and the amount of lube you use, and how slowly you introduce whatever it is that you're using to penetrate the anus with. So ideally silicone-based lubes are the best, because they tend to be quite thick, but also very slippery, and so you need to use a lot of it. So this is the one instance where I would say you have to, it's very important to use a lube. So a silicone-based lube that is thick and using a lot of it. And then also slowly introducing the diameter of whatever it is that you're using. So this is where butt plugs come into play, because
Butt plugs. Okay.
because they tend to be like a lot smaller than, let's say, the girth of a penis. And so it's a good way of like sort of introducing the concept, dilating the anus a little bit more, you know, because it's really not something that you can just like go right in there and expect both parties to have fun. And then the report is that the orgasms are completely different. And so because it is a different sort of nerve pathway. And so, I mean, the other, I suppose, positive is that you can be stimulating the vagina or the clitoris while you do this, which means now you've got, again, it's just about the avenues of like, you know, how do you explore and increase the potential for pleasure.
Geez, that'll be a lot happening. But okay, I don't know how much time we have left, but we do have one question just before you can give us tips. But does a sex doctor enjoy sex knowing so much theory of it?
Yes, I think you know, it's, and I think this is partly why I took to social media, is that like the more people know about it, the more the more you can explore with it, the more you dispel a lot of the myths that we have already. And so it doesn't have to be this clinical thing where like you think, okay, now I'm stimulating the vagina, now I'm stimulating the clitoris, and like but the more you can look at the other options of like how to stimulate and what components you might be missing out on. All that does is just enhance your enjoyment.
Okay. I know I had said one more question before you give us advice, but we have another question, and I think a lot of it comes from a guy. Not that does size matter, or like what is the average penis size?
Yeah, so funny enough, it's a very common question, and it's a very, I think it speaks to, like, everybody is insecure about their own body, whatever aspect of it is, but for men particularly, this is an issue, and I think it's an issue from puberty, like throughout most of their lives. And the truth is, there is no average size. It depends on your muscle structure, like how big a person you are already pre-existingly. There's genetic factors. Different races have different penis sizes. So there is really no average penis size, which is why condoms also, you know, we have varying condoms for varying sizes. So there really there isn't a number, and there isn't necessarily a size which
we need to stay away from. Yeah,
exactly. So there's one, there isn't a size that's too small. The whole ocean of motion of the ocean.
Ocean what? Motion of the ocean.
But again, it is preference, you know, and there isn't also too big a size either. It really also depends on your partner, her size, whether she's had children or not, and even so, if you have a particularly large penis, it's not to say that this will necessarily be traumatic to the woman. The vagina is actually quite pliable.
I mean, kids come out there.
So, you know, particularly when you're aroused, particularly when you're very lubricated, it becomes immaterial.
Okay. And then I think you touched on it a bit with just the size of a woman's vagina. That's something people don't really talk about. What sizes are there, or like
how does it vary? Yeah. So that also it varies a lot. The major distinction is whether you've had a vaginal delivery or not. So whether you've had children naturally, and that usually, and even then, the difference is not big. It's really not pronounced. So yes, it varies. Also, it varies on like your height, your physical makeup, but it's also something that there is no average, and and it's not to say that if you have had children that you haven't necessarily big a vagina. It's just, it's human variation.
Yeah. Okay. Thanks, Dr. Sam. Now, any general hygienic sex tips you have for us? Advice to, you know, switch up the bedroom a bit? Let's start with the first question.
Yeah, so hygiene-wise, it's extremely important because whatever you're experimenting with, you are putting in an intimate place in the body. So, I mean, ideally, you want hands to be clean, you want genitals to be clean, because remember, like even now in the whole season of COVID, like your biggest carriers of bacteria are on your hands, and you really don't want to introduce something foreign to the vagina particularly, but also to the penis. So making sure that if you're going to use toys that you must wash them, and that they must be clean, hands must be clean, and also the environment that you have sex in, you know, not to say you can't be explorative, but it's, you know, make sure that the surfaces are like at least semi.
Yeah, if you're in the club, just wipe,
you know, like
wipe the surfaces.
Yeah, no, but it's kind of true. So,
thank you.
So, and then in terms, what was the next question?
The next question was, how do you switch it up in the bedroom? How do you make it more fun and healthy?
Yeah, so, you know, sex has a way of getting boring because we get into routines. It's like if you run the same route every day, you know, it becomes convenient, and there's a reason why you do it then. Like whether it's the same time of day, because that's when you both have time together. So it's spontaneity seems to be one really useful way of keeping things alive. So whether it's changing the positions that you're having sex in, because that also tends to become a habit. Positions that you're having sex in, when and where you have sex, and particularly the pre-sex or the pre-arousal things that you might be able to do. So whether it's like sending like a naughty message, or you know, something that like just gets the person thinking that, okay, this is not one of those normal days. And then introducing toys, I'm quite a big advocate for, just because they really do open the breadth of what you can do. And so there's an element of excitement with that. And then, I mean, there's a whole spectrum really. It depends on how far you want to go. So I mean, and so I mean, this can go from like either cosplay, where you know you actually like want to get dressed up for it, to the extreme of BDSM. You know, so but there are so many things in between that that you know you don't have to just to make this exciting. We need to now get rough with each other. You know, it can be something as simple as like breath work, or figuring out like what happens if we add this to what we do. So it's really just also do the research. You know, it's like it becomes like any other hobby. If you don't like read up about it, or like find out what people are doing or like using, then it will stay the same and it will get stale, which means the sex will be fine, but it's unlikely to be anything special. And it needs work.
Okay, I'm happy that you mentioned like breath work. I think people take it for granted, guys. Breath is the gift to the world. But yeah, Dr. Sam, thank you so much for having us. Remember, guys, to like and subscribe if you want to get a hold of Dr. Sam. It's here at the bottom. And if you have any more questions, do hit up on our Twitter, also down here at the bottom. And again, thank you so much for watching, and thank you again for your time.
Yeah, thanks for having me.
Thank you. Bye.